I'm here in the studio now with Kate, and we are getting ready to talk about inclusion. Welcome, Kate.
Thanks, Ricky.
Can you tell us about your role at the centre?
Yeah, absolutely. So, my role is as the inclusion manager at the National Centre. And what that means is I do a very similar job to Ricky, but my role is a little bit more behind the scenes. So, it's about making sure that people with intellectual disability are meaningfully involved and included in all the different parts of the centre. We'll talk a little bit about that a little bit later, but yeah, it's part of a bigger team working directly with Ricky and everyone at the consortium.
You said the word inclusion a lot there. So, what exactly is inclusion?
Yep, so I think it's definitely a word we're going to hear a lot about for the conference. And inclusion can mean a lot of different things to different people. Good inclusion for me looks like people having access to the things that they need to do their job properly, to be involved in an activity, to be a part of their community. It means showing kindness and respect to people. So when people are included, sometimes the things that we do to help people feel included, we might call inclusive practices. So there's lots of included going on today. So it's a word that we'll hear about a lot. That's what inclusion looks like to me. What does it look like to you, Ricky?
So, inclusion looks like everyone being treated the same way on every level. So, whether it has to do with work, social life, and general day to day things. So, giving people with a disability a chance to show their abilities and potential. Opportunities to be leaders rather than seen as members of the community who need to be looked after and incapable of decision making.
Absolutely. And I think that there is a lot to be said from the Disability Royal Commission about how we need to make sure people are included in the right way. And I think that something that is really important is that when we talk about inclusion, it's often easier to think about the ways that people are excluded already and removing the barriers that stop people from participating in the things that they would like to do. And quite often that is around physical access or things like hearing and vision. So it's important for us to talk about ways that we can include everybody, and particularly people with intellectual disability. So Ricky, why is it so important to you that we focus on inclusion?
Well, everyone wants to be treated equally and feel seen. Everyone wants to have their thoughts and feelings heard. And we all want to feel a part of the community and be accepted for who we are. So, social inclusion can be a huge problem for people with intellectual disability, and even small acts of inclusion can have giant impacts.
Absolutely. I think it's so important to think about the little things that we do. I mean, we use the term inclusive practice to think about the formal things that we do, but even little things, like knowing somebody's favourite cup of tea or what kind of the way they take their coffee, things like that can make a really big difference to making people feel comfortable and included. And I think we can all relate to feeling safer or doing a better job or feeling more comfortable when we feel safe and when we have that bit of a safe space to do that. So inclusion though is also so much bigger than just how people feel, right? There are real impacts that can come from having a more inclusive society. Would you like to talk a little bit more about that?
Yeah, sure, not a problem. So there's research that proves when people are included, and ultimately respected, they are less likely to experience abuse, violence and neglect. And the Disability Royal Commission highlighted the terrible things that have happened, and unfortunately they're still happening to people with disability. So inclusion doesn't fix this completely, but it's where we need to start.
Absolutely. And I think that, we'll try and keep this a bit of a neutral ground at the moment. There's a lot we could get into around the Royal Commission and the response to that, but I know we have wonderful advocacy organisations and self-advocates who are going to delve into that a little bit for us, but we're going to keep it to health and the health of people with intellectual disability today. So back to your point, what is the first step that we could take?
So the first step, we need to make disability visible in the community. Disability and inclusion shouldn't sit off to the side. And inclusion will make sure everyone can use mainstream services and supports. So this includes social groups, education, workplaces, the media and healthcare, of course.
Absolutely. And I think that, sport's a really great example of that. I know you're a Dragons fan, but I won't hold that against you. I'm sure everyone has their preferences, but sport's a great way to promote that kind of inclusion. And everyone is recovering a little bit from Olympics fatigue. Hopefully it's a little bit better next year or next Olympics, with the time zones. Do you want to talk a little bit about sport and inclusion?
Yeah, I think so. Sport can bring people together, like whether you have a disability or not, can accept people with all disabilities and from all different nations, despite all the issues going on in the world. The Paralympics is kicking off later this month, so I hope they broadcast the entire games, otherwise that's another barrier, of course. And I'm excited, and I'll be able to showcase skills and abilities of people with all kinds of challenges, as well as inspiring the uninspired, which is a great quote. And for people to realise that the people with disabilities can do so much more than they think. Yeah. So even family members also forget that sometimes that they're capable of, doing so much and give the opportunities.
Absolutely. And I think it's things like the Olympics that are on such a global scale and have things that maybe we don't get to see in our everyday lives that get us to think a little bit differently. You're about to see a good example of my ADHD in full swing here, but that's what we're all about, is inclusion and working with the way that people like to work. I'm really curious to know, if you were going to the Olympics, what sport would you like to try?
I'd love to try the sprinting.
Nice.
Yeah, I think that would be amazing.
Have you worked out like a pose for if you're a winner, like a Usain Bolt?
Yeah, a bit of a Usain Bolt.
Beautiful.
Sort of stuff, yeah.
Lovely.
What about you? What would you go for?
Oh, I would love to think that I was able to do something like the gymnastics, and fly through the air. I think that would be pretty exciting.
That'd be cool.
So, yeah, no, I think it definitely gets us to think about the things that maybe we haven't been on our radar before. So I'll get back on topic now. This might happen a little bit, so I apologise to everyone. I hope you're able to keep up with us. Ricky, do you want to talk about some of the ways that we're making sure everyone is included at the centre?
Yeah, definitely. So I talked a little bit about this with Julian earlier, but having accessible health information for people with intellectual disability. This is more than just fact sheets and videos. I want the Centre to promote access to health education, courses and qualifications for people with intellectual disability.
Absolutely. And I think this is something that I've spoken to a few people about. It's a common request that people with intellectual disability can make much more informed decisions and can have a really valuable part in the conversation if they have access to the same information as everybody else. So I agree with you. I think it would be great to see our educational institutions making qualifications and things available for people with intellectual disability so we can all, really be a part of the same conversation. What else would you like to talk about with the centre and how people are included?
Yeah. So we have all agreed to be led by the wants and needs of people with intellectual disability. This means that we make sure everyone is given an opportunity to voice their opinion. Everyone is given equal opportunities, and we want the centre to really work with people with intellectual disability. It's a partnership.
Absolutely. And I think that one of the things that I'm very proud about with the centre is that we have people with intellectual disability all throughout our governance, and governance means the way that we make sure we're doing a really good job. So we have a wonderful co-chair in Judy. We have other council members who also have intellectual disability. Ricky is on our management committee as well. So these are really meaningful roles that people with intellectual disability are playing within the centre. And we are trying to make sure that we are valuing lived experience in the way that it needs to be for the centre, because ultimately inclusive practices benefit everyone, right?
Absolutely. So everyone has needs and support for something. So for example, someone who goes for a haircut, they go to a barber shop and hairdresser. They aren't going to do it themselves, well, generally.
Yeah, I think that there are definitely some people in COVID isolation times that might have some interesting stories and photos to share about doing their own hair at home. I definitely won't admit to any of that, but I feel like my poor daughter's fringe was much shorter than it should have been at times. We're going to get into some of the questions that everybody sent in and their tips, so thank you very much to everyone for being a part of that. But Ricky, before we get started, I'm really interested to know some of the inclusion basics. So what are the things that you think people should be doing and people should know to be more inclusive?
Yeah, so I think a lot of people are already aware of some of the more mainstream inclusive practices. Things like physical accessibility of a place, hearing loops,
Yep.
Auslan interpreters, visual aids, and Braille. They are definitely important, and I think we are used to places and events asking us about those needs.
Yeah, and I think it would be great, and something we definitely tried to do with the conference. So one of the things that you'll hear hopefully throughout the rest of the conference is the importance of everybody giving us feedback. Ricky and I are really keen to hear from everybody about ways that we can do better at the centre, and that's not just Ricky and I should say. Everyone at the centre is very excited and willing to be driven by the needs of people with intellectual disability. So please make sure that you are telling us, what's working, what's not working. Ricky's got very broad shoulders. He can take any criticism. I might be a little bit more emotional about it, but that's okay. So I would love to see, more access requirements for people with intellectual disability considered for those types of events. So do you need documents in easy read? What about breaks? Things like, can they be recorded so we can watch it later when things happen? So thinking more about those less obvious access requirements and reasonable adjustments. Ricky, what's thinking about that, what's probably the most important one for you?
I think the most important one for me is to get to know how a person works.
Yep.
And what they need. so everyone is able to communicate in some way. And a lot of people are happy to tell you what they need and what's going on to work best for them. So other people might not be able to clearly communicate what they need. They might because of the way they communicate. So, or because they have never been given the opportunity to talk about sort of what they need, and people might not know what they need until they try it.
Absolutely. I think you raise so many good points there. I know that there would be a lot of people hopefully watching who use AAC, so augmentative and alternative communication. So that's things that help you communicate in ways other than talking. So signing, iPads. If you're old school, you might have a Dynabox, things like that. Communication boards, things that really help people get their messages across. And I think you make a really good point, because those things often take a long time. And we'll talk a little bit about the time pressures and how that tends to compromise inclusion in a lot of ways. And again, we need to make sure we're giving people the opportunity to have their voice heard in whatever way that means, whatever way we can involve people in conversations, whether it's somebody doing a flick of their eyes to let you know a yes or a no, baring their teeth. You want people to be involved in these conversations. And just because it's a little bit confronting or a little bit different to what you're used to, it doesn't mean it's any less valuable, important to people. There are plenty of people without intellectual disability who can, communicate in different ways. And I think that, it's very important. And I think you make such a great point that whilst there are wonderful self-advocates and a lot of people who are involved in the centre, are used to talking about what they need. They're used to having these conversations. People like yourself have run workshops, and I know Jude does a wonderful job as a self-advocate. But not everybody's ever been given those opportunities, particularly people in supported living environments or people who have come from institutions. Everything's made and decided for you, right? Right. When you get up, what you wear, whether you're shaving today, who you share your house with. So wherever we can give people the opportunity to speak up and to make a choice about what they want, I can't emphasise enough how important it is to let people to do that. So what kind of things can people try or suggest to be more inclusive?
Yeah, so you can use inclusive language. Don't use complex words or jargon. So this is very important in healthcare. We're going to hear from a lot of people during the conference about their experiences with communication and language in healthcare. But medical terminology isn't easily understood by anyone in other medical professionals.
Yeah, absolutely. Yeah. And I think that we'd probably all be guilty of Dr. Googling the referral letter or the scan results later and going, oh, okay, what does this mean? And unremarkable actually means that it's good. I'm not, it's not easy. It's not intuitive to understand and to read. And we understand that these things have a time and a place to use that kind of language. But for people to really have meaningful conversations and to take control of their healthcare, we need to be using language that we understand. And this is a great example of inclusion being, something that we might think is an inclusive practice for people with intellectual disability. Yeah. It's actually just really beneficial for everybody. So, I would really love to see a plain language referral letter or a discharge report from the hospital. I work a lot with my mum. I've gotten mum's permission to speak about her, and she's also guilty of it. We sit there and try and unpack and explain and look at what we're doing. So it is really important to use language that everybody understands. So that's during the conversation. What about afterwards? So you've had the conversation. What about when you're walking away or leaving your appointment?
Yeah, so you put information into plain language. Some people might prefer easy read or easy English. This is when you have short sentences and use photos or pictures to help explain it. It's also a great way to make sure everyone is getting information in a way they can process and understand it.
Absolutely. It's so important to give people time. I know it's something that I need to work on. I'm not very good in sitting in the silence sometimes, but giving people time to process information, whether that's before, giving people time to prepare, giving people time during, and then again, giving people time afterwards as well. It's really important to make sure everybody understands. For anyone who isn't familiar with Easy Read or Easy English or Easy to Read, they are great ways for reading really complex documents as well. I know that there's a lot of us who, particularly for things like the Disability Royal Commission, would have headed straight to the summaries and the easier to read documents, because the language just makes sense for everybody, and it's a great way of being able to communicate.
Yeah, absolutely. So taking on new information can be overwhelming for anyone. Making sure that people are given plenty of time to prepare and be involved and process afterwards is a great way to be inclusive. I think we've all had those moments where we walk away from something and you go, damn, I wish I'd asked that.
Yeah, absolutely. So my poor mum, I promise I did get permission to talk about her, but we do a lot of that. So we write questions before we go. We make notes about what we're going to talk about, because she is someone with a neurological disability. So it's not so much about her ability to understand, but the language, absolutely, that they use to talk about Parkinson's. You might have dyskinesia, which we just call being wobbly, and that makes a lot more sense than using some of the medical terminology that's being used. So I agree with you. I think, especially when you're given follow-up steps as well. I know sometimes when I leave the GP and I've got to go and get a script and a test and then come back in 2 weeks, and you're not given anything to to really help you make sense of that. So I agree. I think that they're great points. So we had accessible language and accessible documents. What's your third one to kind of round out a top 3?
So my third one is don't make assumptions. I know there's a saying about that, but I'm not sure if it's appropriate for a professional work event. But I'm sure some of you know what it is. So just like any other group of people with intellectual disability, they all have different skills and needs. We are all different. What works for me might not work for Judy, and then someone like Fiona might need something totally different as well.
Yeah, absolutely. And I think that it's so important to acknowledge that we're all individual. We all need different things. And I'll just go back to your point you made earlier about everybody has things that they need support with. And we all need areas where we could do with that kind of helping hand. And yes, I'm very proud of you for keeping your work professional hat on. I know that the way Ricky and I might usually talk to each other in the office, I think we would have use some different language to get that message across. But that's one of the great things about being able to work together and work with people that you're comfortable with. So I know most people here are obviously in because you are interested in learning more about intellectual disability health. But what I think is really important is for people to understand what we mean when we're talking about an intellectual disability. So Ricky, do you mind if I hand that over to you?
Sure. So Inclusion Australia has a great definition of intellectual disability that I would like to use. So intellectual disability is a lifelong condition that affects a person's intellectual skills and their behaviour in different situations. It can include difficulties in communication, memory, understanding, problem solving, self-care, and emotional and physical skills. So people with intellectual disability have the same feelings, rights, and aspirations as everyone else. Intellectual disability does not define who a person is, how they should be treated, or how they want to live.
Amazing, fantastic, and hello to anyone of our friends from Inclusion Australia watching at the moment. I know that I put you on the spot a lot, and I'm going to continue to do it because hearing directly from people with intellectual disability is the most important part of what we do. So what does it mean for you to be a person with intellectual disability?
For me, I'm very comfortable asking questions and getting people to explain what they mean. I know a lot of people aren't confident to do this, so that's why it's important to be able to be a representative for people with intellectual disability and making sure that we all have a voice.
Absolutely. And I think you do a really great job at doing that. Sometimes it's getting used to finding a way of being able to interrupt or catch the moments, I guess, to pull people up about inclusion or make a comment. Sometimes can be difficult to know when to step in and do that. I know I definitely haven't mastered that skill of not interrupting, but we've all got work to do. And again, this is part of what it means to be working together. So getting back onto healthcare, would you like to talk a little bit about a time that your intellectual disability has impacted your healthcare?
Yeah, so I definitely have some stories, unfortunately. I've often not been believed because of the stigma associated with intellectual disability. I felt that doctors often see me and judge me, and they might think as an intellectual disability, he doesn't know what he's saying. They've given me Band-Aid treatments because they don't have time to deal with me, and they don't make the time to understand what I need or to explain things properly. We all know doctors have time pressures getting patients in and out the door, and I feel like they would rather be with patients without disabilities because that is easy. It doesn't leave you wanting to come back, and that's why people sit on health problems for so long.
Absolutely, and I think that it's a really important statistic that we keep talking about. I know Julian mentioned it earlier, but people with intellectual disability are dying, 27 years earlier than their peers. And people aren't dying from intellectual disability, and intellectual disability is not a fatal diagnosis. People are dying because the system doesn't work, right? And because the people are dying because they're getting poor healthcare outcomes and poor treatment. So that's kind of the statistic and the figure that really drives us, and something that I don't think we can ever say enough, really, to make it clear about why the centre needs to exist. So we won't stick in the negative, though. Can we flip it and have a think about a time that you had a really positive experience?
Yeah, absolutely. So one that comes to mind is which on the first times I've been seen and acknowledged by a specialist. I went in with my mum, and the specialist directly asked me questions instead of speaking through me. She used simple, easy language and was able to understand my health concerns and then make informed decisions about my care. I felt that I was acknowledged and included and in all the conversations being made.
Amazing. And it's not just about how you feel, right? Like it's probably a better outcome for your health.
Correct.
In that way as well, because everyone's gotten the information that they needed to do that. So that's fantastic. We'll move to our next question. So our next question is, so I will admit that Ricky and I did take a bit of creative license from You Can't Ask That, because we're a big fan of the show. So this is where our questions are coming from. So Ricky, what should I do when I meet someone with intellectual disability?
Talk to them like you would talk to anyone else. It's actually quite simple, Like we said before, don't assume things when meeting them. They may need support with things, but they should still be considered a person like anyone else. You could find common interests and hobbies to talk about. You have probably met more people with disability than you realise.
I think that's an absolutely a great point. So you talk about the assumptions that people make. What kind of assumptions are people making?
Yeah, so that we are incapable of working. People with disability are loyal staff to employers who treat them fairly, so they'll stay in the job longer. That we should only go to disability services or programs. We do a lot more than that, so that we can't be creative. We are capable of doing a whole range of things. We have so many wonderful artists, creators, actors with disability, and not all of us can join the circus doing cartwheels, but we certainly can do a lot of things. We are funny and love to crack jokes, but that might just be me.
I think it's a great quality.
People assume that we always need support with everything we do.
I think that that's a really great point, and it actually ties into a conversation that we were having the other day around you need to find this nice balance, right, of not assuming that someone needs help with everything, because I know there's this kind of natural state a lot of people get into, which is let me do it for you, let me help, let me, it's somehow a good kind of deed if I come and do this for you, because for some reason you need me to do it for you more than anyone else would. But at the same time, you don't want to not offer people the support that they need. So having people with skills that are really comfortable to speak up for the things that they need and that identify their supports is really important. I think that one of the most important assumptions, though, in the conversations that I've had with people about intellectual disability health is people's ability to make decisions. So this assumption that people with intellectual disability aren't able to make good decisions. What do you think about that?
Yeah, well, I think supported decision making is something that I'm really passionate about. So I actually spoke at the Disability Royal Commission about this with my role with CID, or the Council for Intellectual Disability. So we can all make decisions. It's all about making sure that we have the right information in a way that we can understand it, that we are given time to understand the information and the risks, the outcomes of it, and that we have time to ask questions as well. Just like anyone else, people with intellectual disability have the right to make bad choices. Health professionals need to give the same respect to all their patients.
Absolutely. That dignity of risk is just such an important part. And I know, having worked in a disability service provider for a long time, finding that balance between allowing people to do the things that they want to do and the things they should be able to do versus what might be safe or in their best interests. It really is about allowing people to have control over their own decisions and their own healthcare. So our next question was, I'm a new GP and I have not worked with people with intellectual disability before. What do I need to know?
So treat your patients fairly and listen to their concerns. Show people that you are listening and taking them seriously. Have patience with your patients. Talk about being creative. There's obviously some wordplay I put in there. People with intellectual disability sometimes need time to express their concerns and understand what you are saying. So again, use simple language, and if you get it right the first time, it's better for everyone. Your patient has a better experience and better health outcomes.
Absolutely. All right, so this one is a tip that we got sent through. So someone had pointed out the conversation cards about my health cards. I already know the answer to this, but is this something that you're aware of, and would you like to talk a little bit more about this?
Yeah, so these are cards from the My Health Matters project at CID. So I'm very familiar with these cards. So if you don't know about them, they are a tool to help people with intellectual disability, health professionals to have conversations about health. I've got some here. These are great examples of working together with people with intellectual disability to design health resources.
Absolutely. And I think that there are a lot of people who use tools like that, and it's great to have something that is not just specific to a person with intellectual disability or a person or the health professional. That's something that actually engages conversation there between the two. So our next question is around, what advice do you have to support organisations to have more leadership by people with intellectual disability? It's a big one.
Yeah, it is a big one. So give people ownership over their role and their work. We still see a lot of tick boxes inclusion happening where there's someone with an intellectual disability on the board or as a senior leader, but it isn't clear how they're involved and what they do. So my biggest piece of advice is that you need to think about why it is important to have people with intellectual disability in your leadership team. If you just want to look good and inclusive, you're doing it for the wrong reasons. If you want your organizations to be valuing and respecting lived experience, then make sure it carries through the whole team. So inclusion shouldn't sit off to the side, and it shouldn't sit with just one person. I think this goes for any identified role, like First Nations or women in leadership. Think about how everyone works together with these roles, and don't expect that one person to carry all the weight of their community.
That's such a important message. I think that's a huge thing for places to think about when they're doing inclusion, is that that representational burden that can happen for a lot of people. And what I mean by that is when you meet the criteria of a certain group, so whether it's a person with a disability, a First Nations person, a person from a cold background, you are always the person that's pulled up for International Day of People with Disability or for NAIDOC Week, you know. And what we need to be showing is it's not just about having someone to fill that role. Ricky and I make sure that we get into everyone's business and that we're involved in all of the ways that the centre works, because like you said earlier, or maybe you're going to say it soon, I might be getting ahead of myself, but it doesn't sit off to the side,
No.
right? So it needs to be a part of everything. So we're getting close to the end, and I'm surprised that we're tracking along on time as well as we are. Last question was, what gets you excited about inclusion?
The fact that people with intellectual disability will have able to achieve many goals that they want to achieve, as well as they will feel a strong part of the community and be accepted, which is a big part, to prove people wrong that have assumptions about people with a disability. My hope is that it reaches a point where you don't have to have disability groups and inclusion talks, and that it just becomes a normal thing, and that everyone is on an equal level and an equal playing field. So I find that in Australia there's a lot of acknowledgement of disability, but there's still a way to go. The centre is going to set an example of others to follow, be an inclusion trendsetter, hopefully.
Amazing. Are you looking for a new job title? Is that what you're aiming for? All right. Well, look, I don't think that there's anything to add from that. I think you summed that up really beautifully, and thank you for having the conversation with me. It's been really lovely to be a part of the conference and have the opportunity to show the wonderful work that the centre is doing for inclusion. So thank you for joining us. Thank you, everybody, for your questions.